Hi guys, let's see the review of Nelson textbook of Pediatrics, volume number 2, edition 21st edition, that is international edition. These are the authors. Then there are a lot of contributors. Here, let's see the volume number 2, the digestive system, then the respiratory system, cardiovascular system, diseases of the blood, then cancer and benign tumors, then nephrology. First, digestive system. First, the digestive system, clinical manifestation of gastrointestinal disease, normal digestive tract phenomena, like regurgitation definition is given like blood loss, jaundice, and the major symptoms and signs of digestive tract disorders such as like dysphagia, that is difficulty in swallowing, then regurgitation, effortless movement of the stomach, then tabular column for some non-digestive tract causes of GIT symptoms in children. Then anorexia, vomiting, diarrhea, constipation. This all will come under major symptoms and signs of GIT. Then these are tablet mechanisms of diarrhea. Then pharmacological therapy of vomiting episodes. The tablet column is given briefly. Then gastrointestinal hemorrhage. The diagram of a 7-year-old baby has tarry stool for days. And this is for operative features of blue rubber blub nervous syndrome. Then next section is oral cavity, development and developmental anomalies of teeth. That is amniogenesis imperfecta, hypoplastic type. Then disorders of oral cavity associated with other conditions. And the next chapter is about malocclusion, like how the angle of classification of occlusion is given in the picture. Then cleft lip and palate. Here the non-syndromic orofacial cleft. The next chapter is syndromes with oral manifestation. That is Pierre-Robin syndrome. Here dental caries, next chapter dental caries. The pie chart for this is given like prevalence of untreated dental caries. Here the basic dental anatomy like enamel, dentin, gingiva, margin, pulp is given symptom. Then facial swelling of the abscess of primary molar. In each and every chapter the diagrammatic representation is given. Then periodontal diseases. Then dental trauma. Then common lesions of oral soft tissues. Then herpetic gingivostomatitis. Then diseases of salivary glands and jaws. The panoramic radiograph of 10-year-old child is given. Then about esophagus. Here the tracing of esophagus motility is given in the picture. Then the congenital anomalies, that is tracheoesophageal fistula, the radiological findings. Then obstructive and motility disorders of esophagus. Then dysmotility, that is barium esophagus of patients with achalasia cardia. Then hiatal hernia, next chapter, that is gastroesophageal reflux disease, main pathophysiology, epidemiology, clinical manifestation and symptoms according to age. Then about diagnosis, endoscopic, how in endoscopic image the normal esophagus will be. Then about esophageal perforation, esophageal varices. Then the flow chart for purpose, algorithm of ingestion, of button battery in children. Then stomach and intestine, normal developmental structure and function of stomach and intestine. Then about pyloric stenosis and other congenital anomalies of the stomach. The main causes, clinical manifestation, differential diagnosis, and the radiological findings. Then about the treatment and anomalies of the stomach is given in the tabular column. Then about intestinal atresia, stenosis and malrotation. And this is the radiograph of a newborn infant held upright. Then about intestinal duplication, mecal diverticulum and other remains of omphalomesenteric duct. Here the typical mecal diverticulum located on the antimesenteric border. That is given in the picture. In each and every chapter, the clinical etiology, pathogenesis, clinical manifestation, diagnosis, differential diagnosis, treatment and prognosis is given. Then about the flow chart. Then ileus, adhesion, inception and closed loop obstructions, foreign bodies and basos. Peptic ulcer in children, PUD in children. Then about IBD, inflammatory bowel disease. Here the tablet column for comparison of Crohn's disease and ulcerative disease. It is clearly given in the tabular column. Then about ulcerative colitis phenotypes by Montreal classification, like E1 protitis, E2, E3. Here about intestinal transplantation in children with intestinal failure. Here the small bowel transplantation surgery, like 3 basic intestinal transplant procedures. Then about acute gastroenteritis in children. Here antimicrobial treatment for persistent diarrhea is given. Then about functional gastrointestinal disorder. Here the age distribution of functional gestational disorder in infant, toddlers, children and adolescents. In each and every chapter the table is there. Cyclic vomiting syndrome, the next chapter is cyclic. Then acute appendicitis, the main causes, epidemiology, pathophysiology, clinical features, diagnosis, like how the appendicitis risk scoring system is given. For pediatric appendicitis score, that is given. Then about the calcified appendicolitis are seen in how the radiological findings will be. Then surgical conditions of anus and rectum. Here the imperforate anus in female is given. Then tumors of the digestive tract, that is juvenile polyposis syndrome, Pediatrics syndrome, adenomatous tumor, then lymphoma, gastrointestinal tumors, lymphoma, then inguinal hernia, then in about incarcerated hernia, how to proceed, indications of surgery, then exocrine pancreas, like embryology, anatomy and physiology of pancreas, that is the development of exocrine pancreas. In the development of gestation age 6 weeks, 7 to 8 weeks, all those things are given here. Then about the relationship to neighboring structures, like when in up to liver, spleen, all those things. Then pancreatic function test. And then the chronic pancreatitis in CT, how it's shown the radiological findings. Then pancreatic fluid collections, liver and biliary system. The main schematic view of ultrastructure of organelles of hepatocytes. In Wilson disease, like causes, pathogenesis, clinical manifestation, Kaiser fish ring. and pathology, diagnosis, treatment and prognosis given. Then viral hepatitis, like the flowchart of natural history of hepatitis B virus. Then liver abscess. Here the in CT, the images of cryptogenic liver abscess is shown. Then liver disease associated with systemic disorders like bacterial sepsis, inflammatory bowel disease, celiac disease, cardiac disease, etc. Then mitochondrial hepatopathies. Then drug and toxin induced liver injury. Then portal hypertension and varices, like the main causes, pathophysiology, diagnosis, clinical features, treatment, prognosis. Then liver transplantation, and epigastric hernia. Then about respiratory system, developmental and function, diagnostic approach to respiratory disease. The main in extrathoracic airway obstruction is given here, and intrapulmonary airway obstruction. Here the respiratory sounds like basic sounds, lung, trachea, wheezes, rhomae, rattles, their mechanism, origin and acoustics and relevance is given. The normal and clubbed finger viewed in profile. Here is the upper airway form, trachea and the lungs radiograph. Here the schematic of interaction between the chest wall is compared and lung recoil in infant compared to adults. Then chronic or recurrent respiratory system. Then about nasal polyps, like main causes, etiology. Then common cold, sinusitis. Then congenital anomalies of trachea, larynx and rhomae. The main endoscopic example of laryngomalacia. Then emphysema and overinflation. The main chest X-ray and CT scan of congenital large hyperlucent lobe. Then about CVS, cardiovascular system, developmental biology of cardiovascular system, cardiac development. The main cardiomorphogenesis is given as a timeline. Then the fetal to neonatal circulatory transition, that is fetal circulation. This is a fetal circulation before the birth. Then cardiac manifestation of systemic disease. Then main idealized diagram of temporal events of cardiac cycle. These are the electrocardiogram. Like then right ventricular hypertrophy, left ventricular hypertrophy, electrocardiogram of right ventricular conduction, that is left ventricular conduction. Then this is echocardiography. These are the Doppler echocardiography. And this is about the total anomalous pulmonary venous written. The main pathophysiology is written. Then about the clinical manifestation, diagnosis and treatment. Then trungus arteriosus. The main hypoplastic left heart syndrome. Then about pulmonary hypertension. That is primary pulmonary hypertension. The vascular anomalies associated with pulmonary atrial hypertension is given. Here the table column for etiology of pediatric myocardial disease. Then here the diseases of blood, that is thalassemia syndrome. Then about the the major symptoms, causes, etiology, etc. And the enzymatic defects like pyruvate kinase deficiency, then dyskeratosis congenita, then about hereditary clotting factor deficiency, factor 8, factor 9, that is hemophilia A and B. Then the next chapter is cancer and benign tumors. Here, cancer and benign tumors, epidemiology of childhood and adolescent cancer. Here the diagrammatic representation of graph of generalized incidence of most common types of cancer. Then known risk factors of childhood cancers. Then molecular and cellular biology of cancer, principles of cancer diagnosis. Here the MRI and CT of a 15-year-old girl with left tibial night pain is given. Then about benign vascular tumor, rare tumors. Then about nephrology, that is glomerular disease, introduction to nephrology. Here the anatomy of morphology of renal circulation is given. Then about comparison of blood supply of cortical and juxtamedullary nephrons. Here the schematic diagram of glomerulus is given. Then about glomerular filtration. Isolated glomerular disease associated with recurrent cross hematuria. Then Alport syndrome. Then about multi-system disease associated with hematuria. The main causes, etiology, pathology, pathogenesis, clinical manifestation, differential diagnosis. Diagnosis is given, then treatment, prognosis. Then vascular disease associated with hematuria. Then about inherited tubular transport anomalies like Barrett syndrome, renal failure. Then here the symptoms and signs of chronic kidney disease is given in the picture. Then pathophysiology of chronic kidney disease. Here the distribution of primary cause of end stage of renal disease. Then about the calcineurin inhibitors, antiproliferative agents. Then about kidney biopsy, all those things. Then long-term outcome of kidney transplantation. Thank you.